position, and we are going to advance it with the valve down. And now we basically do what we did before, right?
Mm-hmm.
So we're gonna go ahead and advance that implant into the area, and basically advance it like that, and we're done. And we're gonna do the same on the other side. Where's the hole? Right there. Okay, so we're gonna put it through the hole there, and now we're gonna go ahead and advance it. Advance that implant into the subpectoral pocket right there, right? And so you can see how it's filling up, and that's it. So that's how we used to do the transabdominal. So this is a transabdominal. You can let go.
Yes, sir. You're demonstrating both.
Yeah, that's good. Yeah, so that's it. Okay, so what we're doing now, Wendy told me to go a little higher on this side. So when we remarked the patient, we decided we're gonna go a little higher. Dr. Wen is pulling a little bit, so we're gonna end up a little farther out than what we initially planned, okay? And now we're gonna get the electrocautery. We're gonna follow this with electrocautery right here. Dr. Wen is gonna press that way, and I go this way. Dr. Wen has a medical license here in California, so he comes from Atlanta, so he's assisting me during this surgery. And he came here to train in the Transumbilical Silicone Breast Augmentation. When, Dr. Wen?
Yeah.
How long ago when you came here to train in the Transumbilical?
TUBA.
TUBA?
I think 5 years ago.
5 years ago?
Yeah, before COVID.
Yeah, so you've been doing the Transumbilical Breast Augmentation with saline implant.
Saline, yes.
But he's here on a workshop to learn
the implant, the silicone implant.
Silicone implants, right? And you come from Atlanta, right? From
Correct.
Georgia?
Georgia, yes.
Atlanta, right? Or
yes,
no?
Atlanta,
Georgia. Yeah, but notice how, when you do these, there is usually bleeding, right? And there is, this is how, I learned how to do this with, my mentor used a Mayo scissors, and they just cut through these in a matter of seconds, but, it's better to take a little bit more time, do it this way, and just be very meticulous, because, the teaching was that, you're gonna throw this away, so what's the point, right? Just go very fast through this area with even a knife, number 10 blade, or Mayo scissors. Go through this area real fast. But guess what? That is real blood that the patient loses, right? Even if it's 1 or 2 cups of blood, you can go right to lunch.
Here is the specimen on the left side. We even were able to get out some stretch marks for the patient. And this side, it's just fat and no bleeding.
Thank you.
All right, so we have the right side out here, and there is a lot of stretch marks again on the skin. But on this side, we just got the yellow fat and no bleeding.
Thank you.
Button is inside. With my finger, I'm palpating where the belly button is going to come out. It comes out around here. And a good rule of thumb, you should have at least 4 fingers from your incision. And you have more than 4 fingers, I don't think I know for a fact that you don't have to flotate the belly button. You don't have to move it, even if it's up there, very high. We've done belly buttons that are like almost 30 centimeters up, and we still manage to do them. So we're gonna make, this is nice that we have the transumbilical, because usually you wanna go about 1 centimeter on either side, and then I put another point here, and the top part is gonna be a curved area. So it's not quite a rhomboid. I used to do rhomboid, I used to do different shapes. People used to come here for the famous heart shape. It was very popular, but we don't do those anymore. I like this technique better. Thank you. Now I'm just going down to dermis, right? And we're gonna de-epithelialize this area. And as far as I know, I don't know of anybody who does this. I've never seen it described in the literature. Maybe somebody does it. But the key here is that we're going, like we're doing a breast lift, right? We're going down to dermis. So we're taking the epithelium out. The skin has multiple layers, And you doctors know that. I'm mostly talking for social media here. But has multiple layers. And we're going to this layer of the skin, which is called the dermis, right? So we go down to dermis. So why do that? Makes no sense. Why do that? I do it for a couple of reasons. One, is you see any bleeding?
No.
But if I go down with a knife, there will be bleeding, right? And so now, I put in my finger here. And the second reason is I'm gonna leave a rim of dermis around the belly button. I'm gonna leave a rim of dermis that's gonna protect the belly button from burning, because the electrocoagulator can burn, right? It can burn the edge. You see how we burn the edge of the belly button inside, right? We're gonna remove that, of course, and I'm gonna go through all this tissue here with electrocautery. And what Emily is doing is she has room temperature normal saline, and she's cooling the area so that if you put your finger here inside, you'll see how it is very hot from this instrument. Not now because she's cooling it, but later on we don't want it to be hot. But if she wasn't doing it, you will see. Maybe go now and see. Is it hot or not? Yeah. And so she's gonna cool it. Go inside and cool it. See. Notice how nice, flat, and tight she is. And now we're gonna go ahead and remember that burn edge of the belly button that we burned with the electrocautery. Well, we're gonna go ahead and remove it, right? So we're gonna remove that burn edge here with scissors, right? And we're gonna do the same on this side here. Okay, remove it with scissors, right? And so that's it. So we try to make it a shape similar to what's in the outside, right? Similar shape to what's in the outside. And we're gonna make it a little better. But in the meantime, we did the rectus plication above and below the belly button, all the way up to the xiphoid process and the pubic symphysis, the symphysis pubis here. And notice how nice, flat, and tight she is. The rectus plication is a double plication, figure of 8 for the deep layer, and a running or purling for the superficial layer.
Thank you.
Awesome. So we're done with the transumbilical silicone breast augmentation and an extended abdominoplasty with zero liposuction. Yet she does have some high definition, a little bit of high definition with zero liposuction. You can see the semilunar lines and a little bit of the supraumbilical linea alba, the belly button sinking in nicely. We have a workshop here. We have doctors coming from different parts of the United States and the world. We have a doctor coming from Thailand to learn how to do the transumbilical silicone breast augmentation. Thank you.